Hi, we wanted to continue our discussion about procedures, and today we're going to focus on heart procedures. These include EKGs, stress tests, echocardiograms, and Holter monitors. Often some of my patients go to cardiologists, and every year they get a stress test or an echocardiogram, with the assumption being that they're just being very thorough. They're trying to make sure the person doesn't have heart disease. This person may have had a heart attack 10, 15 years ago, and now they're getting this test to make sure they don't have new heart disease. Or they'll come into my office and ask for an EKG, thinking that this will rule out heart disease as well. But the truth is, especially with an EKG, a normal EKG doesn't necessarily mean anything. Most people with heart disease have a normal EKG, and in fact, there's nothing to say that you won't have a heart attack 10 minutes after you have a normal EKG. An EKG is terrible at ruling out heart disease. And a stress test is not much better. It doesn't even matter if you inject thallium or other nuclear dyes. A normal stress test does not mean that you are free of heart disease. To give you an example, of all the people who present with heart attacks or heart-related death to the hospital and who had a stress test within a year, 80% of them will have had a normal stress test, which means that only 20% of people are picked up who have heart disease. The opposite is even more frightening. If you have an abnormal stress test, the overwhelming odds are that you don't have heart disease, and you certainly don't have clinically relevant heart disease. To give you an example, people who had an abnormal stress test and then go on to further testing with procedures such as catheterization, the majority of them turn out to have normal catheterizations. But because of this abnormal stress test, they have to be exposed to a procedure which itself can cause problems, can cause kidney failure, and actually can cause a heart attack itself. In addition to those who do have catheterizations and are found to have blockages in their heart, most of those blockages, if left alone, would not have caused any problems. But instead, people are now told they have heart disease. Sometimes they're put on lots of medicines. Sometimes they're given stents and bypass surgery. Stents themselves can cause heart attacks and also force people to be on medicines that can cause dangerous bleeding. So the whole idea of getting a stress test with the stipulation that we'll find a problem early and we'll fix it can blow up in people's faces. Studies have shown that people who get regular stress tests or EKGs, in fact, are more likely to have problems than people who don't. So why do we keep doing this, and why does Medicare continue to pay for this? This is just one example of testing that can send us the wrong way, but which is considered thorough. And because it's considered thorough, Medicare is willing to pay for it. Medicare rarely puts the brakes on these kind of tests. So when you go to a doctor and they do a thorough exam, you really need to question whether that exam is going to help you or hurt you, and what the reasons are for doing all those tests, because we really need to have reasons. As we're living in an environment where we have to be rushed through our visits, where we're graded on quality indicators, where there's a lot of legal liability if someone has a bad outcome, doctors are much more likely to do tests and procedures, and patients are much more likely to want tests and procedures. On top of that, people who do these tests are paid very well for them. Medicare pays much more for a stress test, for instance, than a doctor to have a discussion with a patient as to why a stress test may not be the right test. So as we go on with other tests and procedures, we'll discuss how Medicare could be changed to make this better. And the next one we'll talk about is the treatment and testing for Alzheimer's dementia.